Greetings and thank you once again for joining us for just a few minutes so that we can share a lot of what's happening here at FHN. This week, it's my pleasure to be able to introduce you to Gabriel Gonzalez. Gabriel Gonzalez is our Assistant Vice President of Behavioral Health Services, and Gabriel oversees the functions for all of our mental health services throughout the communities that we're serving. And we're very fortunate to have a subject matter expert such as him right here available to help answer questions and as well as give us some advice as what we should do during this time. So Gabriel, welcome and thanks for spending time with us.
Thank you. You know, that's a very important question. But the real question should be, how do we understand and manage that fear? Fear is the internal mechanism that lets us know that we may be facing some danger. And understanding that helps us begin to think about what kind of things we can do. Maintaining a little bit of fear or experiencing a little fear and stress during this time, it's kind of normal. This is an unusual situation for us as a world. And so it is normal to experience some of that fear. There are a couple of things that we can do to reduce that intense fear. We can maintain ourselves informed, but it's important that you do that by searching sources that are factual and that are maintaining up to date on the new information. I can share that at FHN we keep up to date, and links to that information can be found within our website at fhn.org. But there are some other things that you can do as well. Things like beginning to feel a sense of control by managing your schedule, by continuing to do social isolation and masking to reduce your threat or exposure, and by attempting to maintain a constant relationship with those that are around you so that you don't feel like you're losing everything in your life. The shelter-at-home orders have helped encourage the social distancing, which is one of the strongest strategies that we have currently to decrease that curve of COVID-19. But as the time gets better, or the weather gets better, social isolation or social distancing in the outside becomes more of an option. So working in the garden, going for walks, even having a picnic outside might seem like things that we can do now that the weather is better. Sheltering in place alone, it's really hard. It's really hard for some people. Some other people might not think it's that hard because they prefer the solace. The Substance Abuse and Mental Health Services Administration recommends a few things to cope. Engaging in hobbies that you enjoy. Maintain a journal about the experiences that you're having during this time. Texting daily with friends and loved ones seems to be a great time right now to catch up with old friends that you haven't talked for a while. They're at home too, and it's a good time for you to talk with them. One important tactic is to relax your body daily and as often as you can. And we do that by practicing relaxation, meditation, prayer, or even simply deep breathing. This is a great question. Controlling your mood during a time when we already feel stressed, already feel fearful, can prove to be very difficult. But this is a time to double up on the things that you normally do to remain calm. So double up on your exercise, double up on your on your rest, increase your pressure or activities, and spend more time in reflection and prayer. And you know, one of the toughest things to do is to remember that somebody else might be experiencing the world from a different point than you, and so their perspectives on the world is going to be different. Trying to walk in somebody else's shoes is important to do right now. Staying in a confined environment with someone that you feel fearful of is a tough thing to do. But there is help. The things that you can do is reach out to authorities as appropriate, and as the situation begins to get more difficult and intensifies. Dialing 911 to get police help if needed. Reaching out to voices in town might be a good option. We will include numbers for you to reach out to if you need to as part of this video and in the FHN website, but understand that you do have help. You're not alone, and if you are fearful, reach out and there'll be help for you. Managing time during this COVID epidemic is one of the most important things that we can do to remain somewhat happy and be able to succeed through this epidemic. We have things that were not a part of your life before, demands that were not there. Now you are asked to work. You're asked to be the teacher to your children. You're asked to manage other things that before were taken in other ways, taken care of in other ways. So creating a schedule and maintaining that schedule and remembering that you are important first. So make sure that you are taking care of yourself, ensuring that you have 7 hours of sleep every day, ensuring that you have your meals, and ensuring that you are doing activities that are pleasurable for you within that schedule will help you feel more successful at managing all the stresses that are coming into your life right now. Remember, when you go into an airplane, and the airplane is going down, they tell you, put the mask first so you can help others. This is the same situation. Our plane might feel like it's going down. Put the mask on, take care of yourself and your needs, and then you'll be able to be more successful at managing all the stressors that are coming at you right now. This is a question that reminds me of the Serenity prayer, which is a prayer that I often use. It goes like this: please grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. Our history with COVID-19 has not ended yet and probably will remain for a bit longer. Preparing ourselves for this and the future after COVID-19 is important. So we must start taking some steps today to improve our sense of life by adding little things, small steps. Increase exercise if you are not doing it before. Ensure that you're sleeping a little bit more today. Things like that will help you your overall experience of life. And we must start now so that we can be ready for what's coming. Yes, I would like to end reminding everyone that we have control over our experiences. We can transform how we perceive the world, and in turn, that will change our reality. So choose to be kind to others, even when they're not kind to you. Choose to recognize happiness, even if it is only for 10 minutes of your day. Remember that you are a part of a larger community. I have seen in this community take care of each other when the needs arrive. You're not alone, and that's when we're strongest.
In the past week, we were able to celebrate National Hospital Week, and that was a time to really say thank you to all of our caregivers that are working at FHN. And though with COVID-19 occurring, it's put a little bit of a damper on our ability to celebrate. We will be doing some celebrations later on this year. But once again, I think it reinforces the importance of our healthcare system and what it means to us as a nation. So that was a fun week to be able to put out some positive messages and also experience some of the appreciation from our community members as a whole. We do continue to manage some COVID-19 positive patients. Gratefully, we have a great team providing state-of-the-art care and have been able to discharge most of the COVID-19 patients that have entered our facility, though we still do treat patients on an inpatient basis daily. One of the other exciting activities was that we were able to resume our elective cases or our elective surgeries. So these were surgeries that may have been delayed or pushed off that people really needed to have done. And so as we begin to do that care, and we have resumed that care, we were able to test out a lot of our safety practices, a lot of our new processes, to ensure not only we were protecting staff and protecting patients, but making sure we're able to provide quality outcomes for those patients as well. So we had a successful week in doing that. Our transition to opening our doors fully once again has been a slow process, and we're doing that intentionally. We want to make sure that we're cautious and we're doing things right versus doing things fast. So a number of people may have noticed that our waiting rooms have been moved around a little bit to provide for some of that social distancing. We also have a decreased amount of office visits that we see per hour or per practice. And again, that's to try and cut down on the traffic in and out of our doors and to make sure that we're limiting contact and allowing time for really thorough cleaning in all of our areas in between caring for patients. So as we open our doors and we welcome our community back in, we're doing so in a very methodical way. We want to, again, ensure that people are feeling safe, that they're comfortable, and we're able to spend enough time with people to meet all of their needs. So we've been really excited about being able to resume some of that business, to be able to resume, more importantly, the care and the connections that many of our staff have with the families that we're privileged to serve. As we see the number of cases continually increasing throughout our state, what's important is to look at that in perspective. So how many more tests are we doing as well? We've been testing on a much greater scale, which is a good thing. What we tend to look at is the positivity rate, or the percentage of those patients that we test being positive. And currently throughout all of Illinois, that's under 20%. In our area locally, it's much lower than that. Our areas have been running about between 10 to 12%, which is a fairly low number, which is good. So even though we are seeing more cases, we're also doing a lot more testing, and that percentage rate is the key number to look at. So once again, looks like we are indeed flattening that curve. Some insights that I can share about our long-term care facilities and our nursing homes is that the individuals running those institutions are taking this very seriously. And so they're taking many steps to prepare to protect our most vulnerable population. And so they have not been sitting back and waiting to be told what to do, but they've been very proactive. They've been following a lot of guidelines that have been issued by public health departments, by the CDC, and we are in regular contact and conversations and coordinating care of patients to ensure their safety. They are taking all of the appropriate measures that they can. Again, COVID-19 is a highly contagious disease, so it's difficult to say with 100% assurance that our long-term care facilities wouldn't be impacted. But they are testing people, they're testing patients, they're testing staff, and we are working closely together with them as well as the county health department to ensure we have the safest environment possible for, once again, our most vulnerable population. A brief comment on many of our local food processing plants is that those organizations have been very collaborative with our county health department. They've been collaborative with FHN in ways that we've been able to partner. Many of those places we've been able to help test all of their employees to ensure that our food service line is being protected, our food supply is being protected. Any individuals that they found positive, they've been put on self-quarantine, that they have not been able to work. And they do that regular testing. They're putting in mechanisms within many of those places to allow for distancing whenever possible and trying to institute the safest practices as possible. So again, working with those institutions in collaboration, I think has led to a much better outcome than some other industries you hear about across the country that have not been so collaborative or willing to make changes or to work together or be proactive and really being able to protect not only the food supply, but more importantly, the people working in those places as well. We've previously discussed the capacity that FHN has. Now that's a capacity I would never want us to fully be able to extend or to even come close to exceeding, but we can handle many more patients in the event that that would occur. One of the challenges that would occur during that, if we've seen a massive surge of COVID-19 patients, is we would stop doing some of our elective surgeries in order to make sure we had a protected environment. And we're currently limiting any patients with COVID-19 just to certain areas of the hospital. If we had a big overrun or a large amount of patients that were coming into our facility, we may not be able to keep those environments completely COVID-19 free. And that would make us really go back and take a look at our business operations and what we would continue to do, what we would stop to do. FHN is licensed for 100 beds, and currently, as of this recording, we have 5 positive COVID-19 patients in our facility. So certainly we have the capability and the capacity to be able to treat many, many more patients. But once again, that's not something that we would want to do. And so hopefully by practicing some of our safe practices and being responsible, our community won't see that kind of uptick or surge. One thing that I'd like to remind all of our communities about is this is a wonderful time of year to enjoy. To enjoy and to have fun and to be positive about the hope and the sunshine and all of the great things that summer can bring. As we continue to encourage people to engage in safe practices and be responsible, that doesn't mean that we can't look at being productive, that we cannot go out and enjoy the weather, enjoy each other's company. Just because we are socially distancing, once again, that doesn't mean socially isolating. And so as we think about people that might be alone, it's a great opportunity to reach out to them and connect virtually, just to let them know that they're being thought about, that you can talk about working on projects together, what's going on that's new, but at the same time doing it in a very safe manner. Supporting many of our local businesses, such as our restaurants with curbside pickup, is a great way to keep our economy moving and also doing it in a responsible, safe way. So the biggest thing I would say to our communities is to get out there and to enjoy.